There must be something more we can offer him than a bowel resection. Something to give him more time. Maybe, can I at least investigate some options?
Yes, of course. Yes, be my guest. It's all part of it, you know, the mentor thing.
Traumatic diaphragmatic rupture, bed 4. Brace yourself, she's a bit of a talker.
Mrs. Chapman?
And you are?
Mr. Rossini.
Mr. Rossini is a senior cardiothoracic consultant. Of course he is.
Maxine, I'm afraid you're going to need urgent surgery.
What?
Otherwise your stomach will strangulate inside your chest, causing major damage. We need to put it back into the correct position.
You've got to pull my insides about.
Not quite, but it's your option for your treatment. I'm sorry if it comes as a shock. Nurse Jackson, see how quickly we can get a theatre for a traumatic diaphragmatic rupture.
No. Can we call your husband, Joe? No. One of us has got to be in the pub. And there's Logan's tea. I can't stress enough. You need support. Can you ask Logan's mum to help out? Joe will be fine. I'd rather it that way. Okay. You know best. Mr. Rossini is one of the best surgeons, so you'll be in good hands.
So you're a crane operator? You know, that was my dream job when I was younger.
Yeah? I spend my day virtually sitting in a cloud. You can see loads from up there. I could even see my girlfriend's house if I squint.
Sounds a little bit like surveillance.
I'm not a stalker, no. Been on like, what, 3 dates now? Going strong. You got any tips?
Well, try not to share every thought and feeling. Women like a bit of mystery. Predictability is the enemy. Have you sent those flowers yet? Good, well, don't go for roses. It's a bit cliched. Send her an orchid instead. What are you going to write in the card?
Something romantic? A poem?
No. No, just spice it up. Tell her what you'd want to be doing if you were there with her.
Oh, I don't know about that.
Well, playing it safe won't get you anywhere. Women like excitement, confidence.
You really think so?
Absolutely. What's your assessment, Dr. Ford?
Constrictive pericarditis causing congestive cardiac failure.
Spot on. Your pericardium's stuck together. It's the result of scarring left by the TB, and it's restricting your heart. There's also some fluid left in the lungs and peritoneum. I'd suggest diuretics and Rampril. Do you concur?
Yeah, I concur.
And that will cure it?
Well, it will keep it under control.
And there may be surgical options.
That's risky, though, right? I mean, I could go to sleep and never wake up.
That's highly unlikely.
Surgery won't be a necessity at this stage, Dr. Ford. Look, tempting as it might be to reach for the knife, surgery isn't always the option if the patient doesn't want it. With medication, he'll have a diminished quality of life, but he'll adapt. He'll have to.
Can someone come, please? The pain in my chest is getting worse. It's like the stabbing in my heart.
Hardly surprising, given your injuries.
No, this is something else. The stabbing pain was there before the accident.
It's not something you mentioned before.
You never asked. I can't breathe.
This'll help.
Should I be worried?
Okay. You need to trust me. Long, deep breaths. That's it.
What's happening to me?
I think you might be having a panic attack. Symptoms can be very frightening, but that doesn't mean...
No, the pain's real. I swear. I thought it was indigestion before, but it was much worse this time.
We'll do an ECG, and we'll see what that tells us.
It's life extending rather than saving, but it could make a real difference to the time he has left.
I agree. It's a good option in this case. Should we put it to the patient?
Mr. Williams, we have another procedure to offer you. It's called a clonic stent. We would put an endoscope, a kind of camera, into the bowel, then deploy a hollow tube made of flexible alloy mesh, which is passed through the endoscope to open up the tumorous obstruction. And then the endoscope is removed, leaving the stent in place.
What will that do?
It could potentially add to your lifespan and prevent you needing a stoma. It is also less invasive than the alternative of a resection.
There's also quicker recovery time, so you'll be up and about in a couple of weeks.
But it's not a cure.
No, but as I said, it could buy you extra time. Quality time to do all the things you still want to do. To be just as alive as the patients you've helped care for.
Let's give Neil some time to think it over.
You'll be delighted to know your ECG is normal.
I don't understand. How can it be?
Like I said before, panic attacks can seem very real.
No, it's more than that. Can't you get that art doctor to look at me again? He's the expert.
Mr. Rossini's already made his assessment.
Rossini? That rings a bell. That's where I know you from. You were in the papers. You and him are that couple whose son went missing.
I'm sorry, you must have me mixed up with someone else. You need to rest.
I just don't understand what there is to think about. A colonic stent would give Mr. Williams a new lease of life.
Well, it's a better option than a colostomy bag, but there's still a risk of slipping and eroding.
It's a very negative way of looking at it, in my view.
Sorry, I think you've forgotten the milk. And possibly the tea?
It's green tea. It's good for you, full of antioxidants.
Take your word for it. Okay, that's too hot. You see, this is why I drink all this tea.
Sasha, you needed.
The dream team are working together again. Is that a problem?
Maxine Chapman recognized us as Nico's parents.
What did she say?
Nothing. Really, just bringing it up through me a little.
I'm sure Dr. Digby can deal with her in your place if that's what you want.
It's fine, really. Let's just get on with it.
Okay.
I just don't want to spend the rest of my life in pain.
Well, I do understand, of course, but Mr. Levy and I have to know you're absolutely certain this is what you want.
I am. It's no way to see things out. Surgery and hospital wards, a long stint in a hospice. Not for me.
What's happening?
I've decided against the colonic stent.
And Mr. Williams has requested a DNR.
I don't understand. With surgery, you could have months, years.
You have no way of knowing that, Mr. Johansson.
And even if it were true, what sort of years would they be?
They could be the best years of your life. Think of the people you've met, the impact they've had on you.
And I admire every single one of them, but I don't want to go like that. I want it over quick. I'm sorry if I disappointed you.
Please, Mr. Williams, I urge you to reconsider.
Mr. Johansson, please.
Look, I know what you want to say, but
Listen to me. I know how you feel, but you're overstepping the mark. So just take a break and cool off.
Mr. Levy wouldn't have taken that decision lightly, but if you give him a chance, you could learn a lot from him.
what? Like how to give up?
Her breathing's worsened. Don't worry, Maxine. They're going to help you.
Can you swallow? Quick, Paul.
It is a temporary fix to help you breathe. Okay. We get on to theatre, please.
It is you. You and your job, saving people, must have made it even harder with your son so out of your control.
Okay, Maxine. You need to stop speaking and let your breathing normalize.
Did you find him? You didn't, did you? How you do all this after what you've suffered?
You are resting, mate? I'm trying to look out for you. Don't you think you need a little bit of time to...
What?
I don't know, heal? I understand why you don't want to talk to Dr. Ford about it, because, you know, well, he's just a bit young. So, if you want to have a proper chat, you know, man to man, yeah? Okay. What?
Let's talk about this.
Okay, fancy a pint now?
No, there's no time like the present.
You must miss her.
I do. Yeah. Nights are the worst. Staring at her side of the bed, the empty space. Reflecting the emptiness I feel inside.
Mm-hmm.
What should I do?
The gym, you know. Get down there, maybe, you know, whack a punch bag or something.
Yes. Or maybe you can come with me. We could spar together. I mean, there's nothing like, well, aiming for a real person. Ah. I'm feeling pumped just thinking about that.
Hold that thought. I need to crack on.
Let me know when you want to go a few rounds. Sparring partner.
So are you saying that Mr. Williams lacks the capacity to make such a decision?
Would that make you reconsider?
Frederick, much as we would sometimes wish to, we can't simply bend the rules to suit our own wants, and whilst I know you think you're doing what's best for Mr. Williams...
What if he was being unfairly influenced?
And who would be doing that?
Or can I speak freely?
Yes, you may.
You have admitted to me your own history with depression. And you said yourself it may have influenced how you behaved at times in all areas of your life.
Yes, and?
And you found your own way of dealing with that, and I respect it. But I happen to know Mr. Levy is undergoing treatment for such a condition. And however good a surgeon he may be, I have to question if, in some circumstances, his medical decisions are being influenced.
I would advise you to say no more unless you wish to force me into taking professional action. I'm still your superior, after all.
All I meant...
Yes, I know what you meant! Right. Your objections regarding Mr. Williams have been noted, but Mr. Levy and I have decided to respect his wishes, and I would ask you to do the same. It is not our right, is it, to question how people decide these issues. We only need to ensure they have the information they need to make an informed choice and the capacity to make that choice. Is that clear?